Well, today on the show, we're back out on Canal Road at the Gulfport Care Center talking to Tangi Carrillo, who is the marketing director,
Correct.
and William Trevette, who's the new administrator out here. Glad to be here again and talk a little bit about what's going on out here at Gulfport Care Center. Y'all been open for 2 years now.
Correct. We opened in August of 2014, and we are a 90-bed short-term rehab, skilled nursing, and long-term care facility. So if a patient has been in the hospital, had some type of surgery or medical event such as a stroke, they need a little more therapy before going home, we bring them here, and they can stay anywhere from 2 weeks to 2 months, just depending on how much therapy they need. But we make sure they're safe and able to go back home into the community. And then we have long-term beds for our residents who are no longer able to be at home by themselves, or maybe family members can't meet all of their needs and they need more long-term care. We bring them here as our residents.
Okay, all right. Well, this is a really, really beautiful facility. So what we're going to do is, if you don't mind, sir, I'm going to take this lovely lady and we're going to go out on a little tour and show you all the wonderful things that they do have available here at the Gulfport Care Center. They're located on Canal Road in Gulfport, a couple miles north of I-10?
Correct.
A couple miles north of I-10, a little bit north of Landon Road. So let's go take a look around here today. Now, Tangi, the way you have this set up here in the middle, there's a reason for this.
Yes, this is actually unique to most facilities down here on the coast. Our rooms are separated into 4 separate hallways, and we have a centralized nurses station, which gives our nurses a better view of each of those hallways. If a nurse were to have to go into a room to treat a patient, the other nurses here at the nurses station would still be able to see down their hallway and be able to cover that hallway.
That's good. That's
Very
it.
good.
It gives the residents here the freedom to kind of move around, but still be kind of under the watchful eye of everyone here.
Correct.
That's good. And then back in the background, and we'll show you in a little bit area later, is a big dining room area.
Yes, yes.
But there's a lot of different things. I mean, the way that you've got this set up that really caters to the residents here, whether they are long-term or whether they're short-term. Now, what type of qualifications do they need if, let's say, someone wanting to come long-term? I guess the family come and interview with you, or?
Well, we invite anyone to come in at any time, drop by and do a tour of the facility. It's real important, I think, to have someone come in and sort of feel comfortable with the place that they're coming. So we invite anyone to stop by at any time, sort of get a tour of the facility. Of course, you need a doctor's orders to come in. It would be under the recommendation of a doctor, and we would get all the paperwork that we need. There's an admission packet that we would have the family fill out, and then welcome them in.
All right, and pretty much the same for short term. I mean, they're coming here for rehab or something like that.
Correct. Most of the time, the patients have been in the hospital. They've had some type of surgery, and have done some therapy in the hospital, but just need that little bit longer before they're ready to go home.
Exactly.
So usually our rehab stays are 100 days or less.
Okay. Well, let's show you some more of this beautiful facility here at the Gulfport Care Center in Gulfport. Now, Tangi, what is one of the things that sets you apart from other care centers as far as when it comes to short-term care?
Well, Jim, all of our short-term care rooms are private rooms. So when a resident comes in, they're in their own room. They're fairly large rooms where family members can come in and stay. We don't allow overnight visits, but they can come in and sit with their family members. Everything comes equipped. We have closet space, we have drawers, just kind of like their own bedroom at home. We allow you to bring in items if you want to, just to kind of make it feel more homely.
Pictures and things of the family.
Correct. Anything to help the recovery process and make the residents feel more comfortable.
Very nice. Now, Amanda Morris is the rehab director and a certified occupational therapy assistant.
Yes, sir.
Tell us a little bit about some of the things that you deal with here, in the rehab.
Well, we get residents that come in from the hospital with cardiopulmonary disorders and strokes and just general weakness, dementia, dysphagia. We get a variety of different disorders that come in.
And of course, you work with each one of them on an individual basis, but do you ever get some of them in here like in a little group setting?
No, we usually don't have group therapy. We usually have individualized therapy. We have specialized programs to deal with a lot of the different disorders. We have probably 15 or 16 specialized
specialized things to work with each one.
Yeah.
Well, yeah, because it's going to be different. I mean, opposed to someone with a cardiac issue,
Yeah.
Someone who's had a stroke,
Yeah.
because their mobility is going to be kind of limited.
Yeah.
Getting those motor skills going. Hips, they had a hip replacement.
Yeah, we
or
have
something like
orthopedic
that.
programs as well. Like I said, the strokes and the cardiopulmonary and orthopedic things are all different, and they all need to be specialized and have different treatment strategies to go along with that.
And of course, you've got a big room with all kinds of different types of equipment to do it in.
We've got a lot of equipment. We're very lucky to have all of it. Our building supplies us with everything we need, so we've got a good thing going.
Well, one of the good things too about once you come in here and you go through all your therapy work and whatever they have to do, is you're going to end up building up a little bit of an appetite. So let's go to the dining room area next and show you what they have. And of course, the little cart that they push around here, it's got some really cool stuff on it. Well, of course, after a good workout, got a little bit of an appetite, and the dining room here is set up for you. And that's one of the great things too about the Gulfport Care Center. You take, really, you're really particular about the diet because everyone's going to be different.
Correct, that is correct. We are able to accommodate all types of different diets. Some people come in and they only have, they can only have their food chopped up. We have low sodium, cardiac diets, different things like that. So our team is able to accommodate all of those needs.
Yeah, and that's 3 meals a day.
Correct.
And snacks, I see.
Yes, we also have a restorative team that comes through in between the 3 meals a day, and they offer juices and snacks for some of our residents as well. We're also able to accommodate diabetic diets as well. So.
Well, I mean, nutrition is one of the key things in in rehab and in recovery, and of course, those are here that are long term that they can enjoy their time here.
Everybody loves a snack.
Oh, are you kidding me? And of course, one of the great things about the snacks too is you have a theater room.
Exactly.
Will they deliver to the
We do. We have popcorn ready for the theater room or anything else that you could crave while watching a movie.
And different types of movies, choices to choose from?
All types. We have oldies, classics. Some people like the scary movies. Whatever they want, we try to accommodate and get for them.
Well, I'm going to go over here and pick out, see what I want to go with a movie here at Gulfport Care Center in Gulfport. This is truly a full-service care center.
It is.
It's really
it
nice.
is.
Now, if you want some more information, I guess just call the number on the screen.
Correct, or just stop by anytime. We give tours Monday through Friday from 8 to 5. We can come out on the weekends. Just give us a call. We can set up an appointment.
And you're located on Canal Road in Gulfport,
Correct.
just north of Landon Road.
That's correct.
On the right-hand side if you're going north. Thank you so much
Thank you,
for the
Jim.
information.
Thank
Beautiful,
you.
beautiful place here.
Thank you.
If you'd like some more information about the Gulfport Care Center, the number's on your screen. Give them a call and come out and take a tour.